Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. May I come in?
Yes, please be seated. May I know your problem?
Well, I'm a patient with marginal B-cell lymphoma, for which I had a splenectomy 2 years ago. But last year I developed a diffuse large B-cell lymphoma that was treated with CHOP reduction. The disease again went into complete remission.
Okay. Then what happened now?
I was doing well until recently. A few days ago, late last week, when a swelling developed on my left testicle, I had fevers and chills for the past few days and I felt weak.
What's your age?
45, doctor.
Do you drink or smoke?
Well, I used to smoke and drink, but I quit completely.
Your previous illness and surgeries.
I had B-cell lymphoma and diffuse large cell lymphoma. I had a splenectomy.
Are you taking any medications?
No, doctor.
Are you allergic to any medications?
No, doctor.
May I know your family history of illness?
Well, my mother had paralysis before she died at 70. My father is deceased at the age of 84 of head and neck cancer. My 56-year-old brother with type 2 diabetes and blindness are secondary to diabetic retinopathy. My 41-year-old younger brother has hypertension and my younger sister has thyroid disease.
Okay, well. As per the laboratory data, your white blood count is 13.8, hemoglobin 14.3, hematocrit 42.4, platelets 235,000, SMA 7 shows potassium of 3.9, and glucose is 213. Physical examination shows no conjunctival pallor or Icarus. No adenopathy, no corticoid bruits, lungs are clear, no gallop or murmur in the heart. Your right testicle is markedly erythematous and swollen and tender. Endocrine shows symptoms of type 2 diabetes mellitus. You have left testicular swelling. It is tender. Etiology possible epididymitis or possible torsion of the testes. You have a history of diffuse large cell lymphoma and remission. You have a history of marginal B-cell lymphoma status post-splenectomy 2 years ago. You have a history of diabetes mellitus. I recommend that you have the ultrasound tests done for the scrotum and abdomen. I will ask for a CT scan of the abdomen and pelvis after seeing the ultrasound reports. I am prescribing IV antibiotics. See me once you...
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Yes, good morning. What's your problem?
Well, doctor, I have a sinus problem. I get postnasal drainage, facial pain, headaches, sore throat, and congestion.
For how many days have you been facing this problem?
For the past 2 weeks, doctor. I'm also getting snoring tooth pain and nasal burning.
Is it moderate or severe?
It worsens in the evening and morning.
What's your age?
47, doctor.
Did you have any illness previously or any surgeries?
Yes. Surgeries. Gallbladder and hernia.
Do you drink or smoke?
I don't drink, but I smoke 1 pack of cigarettes per day for the past 15 years.
Does any of your family members have any illness?
Yes, I have a family history of allergies and hypertension.
What are the medications you are taking?
Claritin dilantin and Rhinocort nasal spray.
Are you allergic to any medicine?
No, doctor.
Well, your auricle external auditory canals reveal no significant abnormalities bilaterally. TM's intact, with no middle ear effusion, and on mobile to insufflation. Your intranasal exam reveals moderate congestion and purulent mucus. Your oropharyngeal examination shows teeth alveolar ridges reveal a missing molar. Examination of the posterior pharynx shows a prominent uvula and prominent postnasal drainage. The palatine tonsils are 2+ and cryptic. The palpation of the anterior neck reveals no tenderness. Examination of the posterior neck shows mild tenderness to palpation of the suboccipital muscles. Facial examination shows there is bilateral maxillary sinus tenderness to palpation. Waters view X-ray reveals bilateral maxillary mucosal thickening. You have acute maxillary sinusitis 461.0, snoring 786.09. Well, I am prescribing you Augmentin 875 mg twice a day and Mucofun 800 mg twice a day. Follow these medications for 3 weeks and meet me after that. If the conditions don't improve, then I will order a mini sinus CT.